Now I would like to invite Dr. Shailendra Sahu sir, Professor and HOD in the Department of Prosthodontics to educate us on the topic of evidence-based dentistry. Sir has numerous publications to his credit. Over to you, sir.
I hope I am audible now. Good morning. First of all, good morning to respected DMAM, my dear colleagues, and my dear students. First of all, I like to express my sincere gratitude to our Dean for giving me an opportunity to present my paper in this webinar. Special gratitude to the Department of Periodontics for conducting this webinar flawlessly. Before I begin, I want to have a small attention test for our students. So just now you will get a small video and there is a chocolate here. You have to identify the chocolate. You have to identify the cup in which the chocolate is there at the end of the video. Hint is the chocolate must be in one of those pink cups. So the idea behind this test is it is known as a selective attention test. You always have a focus on one aim at a time. If you want to focus on a different subjects at a single time, there are chances of distraction. So multitasking is a myth. I request all of you to have a single focus on the presentation only. Now, why research is important for students? First and the obvious reason is dissertation is important for getting the postgraduate degree of Master of Dental Surgery. Second thing is, if your dissertation or if your research is good, you might get a chance, get it published in one of the recognized dental journal. And this will be a matter of prestige not only for yourself, but for the department as well as for the institution. But remember, the ultimate aim of the research is to increase the stock of the knowledge, which will lead to the development of the new technique. And this technique then should enter into the healthcare system. So we can see that research is important not only from the personal point of view, but it is important for the whole community. So research important from personally, for the department, for the institution, and for the whole community. So students, topic of my presentation is evidence-based dentistry. And here my aim is to make you aware of the role of research in making the clinician's life easier. And these are the learning objectives of this presentation. First is we will see the definition of evidence-based dentistry, why this evidence-based dentistry is important, or what are the rationale of the evidence-based dentistry, what is evidence, what are the different levels of evidence, and how does this evidence dentistry works, or what are the steps involved in the evidence-based dentistry. So we will start with the definition of evidence-based practice. Evidence-based practice has been defined as the practice of dentistry that integrates the best available evidences with clinical experience and what a patient prefer in making clinical decisions. So this is the textbook definition of the evidence-based practice. Now remember, every definition has got its own life. So you have to minutely observe the definition. Now let's minutely observe the definition of evidence-based practice. Now the first part of the definition says that it is a practice of dentistry. So practice of dentistry, that means it is an approach, one of the approach to the oral health care. And this approach will take our dentistry to the next higher level. Now, the other important parts of the definition are evidences and clinical decisions. Clinical decisions here means the judgments you take for the betterment of the patient. So these judgments should ultimately benefit the patient. Now, evidences are the different literature reviews available in our profession. We will study these evidences in detail. But the most important part of the definition of evidence-based dentistry is the word integrate. So the evidence-based dentistry is an integration of not only the available articles or the literature present in the profession, but also the expertise of the dentist and the patient's references. Now, if you see this image carefully, you will observe that all these three factors, they are in dynamic state. That means the new evidences are coming daily. At the same time, dentists should also increase their expertise, and the patient should also be encouraged to take up the new treatment modalities available. Now, next question arises is why we need this evidence-based dentistry or the evidence-based practice? Because there are various problems in our practice. Now, the first problem is most of the time nowadays when the patient comes, he is loaded with lots of misinformation. And the source of this misinformation most of the time is the internet. Now, this information is taken from a documentary which is there in the Netflix. So if you search the Netflix, you will get a documentary known as Root Cause. So in the root cause, they have given the disadvantages of the root canal treatment, and they have made this observations that root canal can cause from a simple problem like insomnia to the breast cancer, impotence, all those things. So now this Netflix has a reach of the entire world. So if the patient is viewing such documentaries, then he will definitely have a misinformation about the treatment modalities which the dentist provides. So this is the first problem in our practice. Now the next problem in our practice is related to the ourselves. Now it is generally said that whatever is taught in the colleges and the university, most of the time this knowledge is not helpful in the ground or in the field. Now this statement is applicable not only in our profession but for the entire university level courses. But this problem becomes more acute in our profession. So there was a very important study done in the year 2005 where they observed that a dentist, where they observed that a medical professional who spends more time got an inverse relationship to the overall knowledge, diagnosis, and the therapy provided. So this study concludes that as you spend more time in the practice or the more experienced you are, the less likelihood that your knowledge will decrease, your ability to diagnose and provide the appropriate therapy or the treatment modality will decrease. So whatever most of the time it is said, practice makes perfect. But in our profession, it was observed that exactly inverse was happening. So now people try to find out what are the reasons for this. So the first reason was there is a slow transfer of research into the practice. So this gives approximate time frame between the original research and the time it reaches into the practice. So they have calculated and found out to be around, this average is around 9.3 years. In some cases, it can extend up to the 15 to 16 years. This figure might look exaggerated, but fact of the matter is still that the research or the literature which is there and the practice which we are doing it in our clinic, there is a vast gap. Second thing is explosion of new knowledge. So every year, the amount of the articles in the dental literature, they are increasing exponentially. So if you observe this graph, this represents the number of new articles added in the index general in a decade. So you can observe that there is an exponential increase in the number of the articles. Third thing is there is too much misinformation. Now this misinformation we have seen that it is there in the patient, but even the dentist or the practitioners, they are also prone to misinformation. Now this source of misinformation might be some tabloid journals or the medical representatives. Now the non-peer reviewed journals, they are generally based upon the expert comments, and they cannot be taken on a face value. Second thing is, last thing is that practitioners don't want to change over a period of time. And there might be some valid reasons for these barriers to change. One is the time. So anyway, the practitioners, they are very much involved in the practice. They get very little time to do the literature search. Even if they find out the time, the accessibility of the literature, because these practitioners, they are mostly not accessible to the libraries. And even if they are able to find out the articles related to their patient, most of these articles are written in a very complex scientific manner, and they are not readily available in a easily chairside language. So these are the different barriers which makes the dentist unacceptable to new changes. Now, all these problems were recognized early by two doctors, Dr. Gordon and Dr. David. So since they were associated with the university, they find out that the reasons for these things, this problem is because we are not teaching the medical knowledge in a right manner. Therefore, there is a no-do gap. No-do gap means what is available in the literature and what we are implementing in the clinics, there is a lacuna. That is known as no-do gap. So these were the two persons who initially observed this problem, and they also presented the solution. And their solution was that whatever procedures we perform in the clinic, that should be based upon evidences. And this type of healthcare is known as evidence-based healthcare. So Dr. Gordon and Dr. David were the first to suggest a new method of practice which is based on evidence. So they also highlighted the differences in the traditional approach which we are following and the new approach. So the traditional approach, which is generally observed in the undergraduate teaching, is based upon the lectures. So teacher gives the lectures based upon his understanding of the important points on a subject. The students memorize it and then tries to use that information on the patient in the clinics. Now, evidence-based approach exactly works in exactly opposite way. Here, we start with the clinic. We start with the patient. So the students identifies the problem in the patient, and then he goes to the literature and he search the evidences in the literature. And once he finds out the evidences, he then applies it. So this is a brief EBM approach and how it is different from the traditional approach which we are mostly following. So Dr. David and Dr. Gordon, they identified this no-do gap in the medical profession. But remember, this no-do gap is available in our profession also. Use of effective intervention without implementation strategies is like a serum without a syringe. That is, cure is available, but the delivery system is not. Now, if you compare it with the current scenario of the COVID, a group of the scientists is working on the development of the vaccines. At the same time, a group of experts in the field of the community medicine is trying to devise the implementation strategies. So as soon as the vaccine is available, it can be given to the needy people. So these type of thing happens only in case of a disaster, that is a national disaster, and this is being monitored at the highest level. So that's why these things are happening. Development of the new vaccine, at the same time development of the strategy to implement it. But most of the time uh, we are not the situation is not favorable like this. So a new knowledge appears in the literature and it goes unnoticed. So before we can start with how to practice with the evidence-based approach, we must know what is evidence. So whenever we say evidence, the first thing which comes into our mind is this evidence is something which is used in the legal terminology. So evidence mostly means something which furnishes proof of something. So in the legal terminologies, these evidences can be direct, circumstantial, physical, or testimonial. Now, same way, this evidences in our dentistry, they are also of different types, which is shown in this pyramid. Most of the new ideas, they start in the laboratory. Then it is checked in the animal studies and then few human volunteers. Then you perform the case control studies and the randomized control trial. So if you see the pyramid in the literature, you will find most of the articles towards the bottom of the pyramid. But as you go up above the pyramid, number of articles will reduce, but clinical significance of that article will increase. So these evidences can be classified into two groups: pre-appraised evidence and the primary or non-appraised evidences. So now, before understanding what is this pre-appraised evidence, let's go back again to the legal thing. In legal thing, there are something known as direct and circumstantial evidences. Direct evidences, say for example, if a crime is committed and a videograph is available. So that videograph is considered to be a direct evidence. But remember, a judge will not accept even that direct evidence of the videograph unless and until it is reviewed by some experts. So same way, in our medical profession, these evidences, they can be grouped in two groups: pre-appraised evidence or non-appraised evidence. So pre-appraised evidences, they are the evidences which has been reviewed by a group of experts who have a knowledge in evidence-based practice. So these are the primary evidence or the non-appraised evidences which are available in the literature. So this generally starts with the case reports, case series, expert opinions, and then it goes on to the randomized control trial. Then we have got some pre-appraised evidence. Pre-appraised evidence means a group of experts has looked into these evidences and then they have come up to a conclusion. Now these start with the systematic reviews. Now the systematic reviews are the advanced form of the literature reviews. So whatever all of you have done a review of literature. So these systematic reviews, they are advanced form of that literature review. In this, what happens? All the articles, they are combined together, and then all these articles, they are considered to be one article and one study, and then conclusion is drawn. So in this way, what happens when you studied all the articles together or the cumulatively, then obviously the sample size will increase. And if you apply some statistical tests, then these type of systemic reviews will become meta-analysis. So meta-analysis, if you have applied some statistical test to the systemic reviews, then it is known as meta-analysis. Now these systemic reviews and meta-analysis, they are done by the group of experts who have expertise in the evidence-based practice. Now, if you see these systematic reviews and the meta-analysis, they are again written in very scientific language, in biostatistical terms. So they are again very complex to understand. So what the different groups have overcome this problem by coming out with the critical important summaries of the systematic reviews. Now, American Dental Association has come out with some very important summaries of the systematic reviews. Now, ADA has divided these summaries into two groups. One summary is for the practitioners and another summary is for the patients. So they are written in a very easy to understand languages for the dentist as well as for the patients. Now, clinical practice guidelines, they are generally released by a statutory body to treat a particular cases. Like for example, in the present scenario, the COVID cases are there. So the ICMR has come out with a detailed guideline how to treat such type of patients. So they have given a very exact guidelines what you should do if the temperature rises beyond this, if the oxygen saturation reduces below certain level, if the patient has comorbidity, then what are the protocol. So these are the clinical practice guidelines which makes the treatment or the implementation of the available literature much easier for the practitioners. So these are the pre-appraised evidences. Now, based upon these evidences, they are grouped under 5 categories. Obviously, the meta-analysis will be at the top of the pyramid, and the case reports, case series, they will be at the bottom. Now, next part is how this evidence-based dentistry works, or what are the steps which are involved in the evidence-based practice. So this is the cycle. So you can see that it has got no starting or the end point. So generally we will start with the patient. So we'll start with the patient, and in the patient we will look for the problems. So for the problem, best is to frame a question. Now, why this framing of a question in the form of the problem is important? Because if you frame the right question, then you are able to search well, because framing the question will help in getting the keywords. So once you get the keywords, you can focus on that keywords and look for the evidences. Like the attention test we done at the beginning. Now this is known as the selective attention test or the invisible gorilla test. So what does this test specifies? That you should be so focused in your aim that even if a gorilla comes into your room, you are not distracted. So this is the idea behind the selective attention. So just focus on the important aim of your study. So if you narrow down your aim, then you will be able to you will able to get the answer quickly. Also, you will exactly know when you have reached the answer. Now, to define the question, we have to follow a fixed format. Now, this format is known as the PICO format. So, a good clinical question should have these 4 factors. First is the P stands for the population, patient, or the problem. I for the intervention. So intervention here might be, say, suppose a new treatment modality which you want to check. Next, comparison, which is optional, which is the present conventional treatment option available. And O is the outcome, what the result you want to achieve. So let's see an example. So this question has got all the features of a good PICO. So in this question, in patient with periodontal disease, this periodontal disease is the problem. Next, what will be the intervention? Intervention will be short-term systemic antibiotics. And this short-term antibiotic treatment, we are comparing it with what? Surgery. So we are comparing it with the surgery. And what is our ultimate outcome? Our ultimate outcome is reduction of the pocket depth. So if you frame your problem question in this PICO format, you will get the important keywords which will help in identifying the evidences. This is another example taken from the British Medical Journal. Parachute used to prevent death and the major trauma related to the gravitational challenge. Now, if you read this article in the British Medical Journal, you will find that this article is a satire on the literatures, on the different studies, on the on the randomized control trials. What they mean to say is, yes, the randomized controlled trials or framing of the question is important, but they should not take away the importance of common sense and the clinical judgment. Now, this parachute used to prevent the death doesn't require any test. Okay. So this is a common sense. So in the practice also, just because you have to search the evidences or you have to search the literature, don't frame the question. First of all, apply the common sense. If it is there, then use that thing. If it is not possible, then go for the literature search. Next important thing in the evidence-based dentistry is the accessibility of the literature or the searching of the literature. So whenever you search the literature, you have to follow this pyramid. So now in the literature, what happens? Most of the articles will be available at the bottom of the pyramid. But remember, when you are doing the literature search, start from the top of the pyramid. So look for the systematic reviews or the meta-analysis, because if they are available, then the conclusion will also be there and you don't have to look for the other articles. Now for dentistry, similarly, guidelines and the summaries are also available from the American Dental Association. So first of all, if you are searching, go to the evidence-based dentistry website and search for the guidelines and the summaries. If you are lucky and you are getting the guidelines and summaries of your problem, then there is no need for the further search for the solution of your patient's problem. If it is not available, then go for the systematic reviews. Now, these systematic reviews, they are again available in the evidence-based dentistry website or the PubMed. How to do the PubMed search? We had got a good presentation. If you are getting a systematic reviews, then again you can stop and you will get the answer. But if the systematic reviews are not available, then you will have to go for the primary studies. For that, you have to do the PubMed search. Once you get the articles, if that article is a pre-appraised articles, that means that article is either a critical summary or the systematic reviews or the meta-analysis, then you can directly go to the apply. But if the article is a primary article, then you have to appraise that article and then apply in the patient. Now, this appraisal and application of the article should again follow some logical steps. So you should ask these questions. Are the results given in the articles valid? What are the results? And can the results be applied to my patient? So first thing, you see whether the results, whether the patients which are there in the article, they are matching your patient or not. If they are matching, then you can read the complete article. If they are not matching, then again you have to look for some other studies. And for matching your patient, you have to see these three requirements. Then you have to check the validity of the result. Now, for checking the validity of the result, you have to go to the material and methods section. In the material and methods section, look for the study design and see whether all these factors have been taken care of or not. Then go for the results. In the results, look for the biostatistical analysis, certainty of the effect, and the magnitude of the effect. And if you find that answer, then you can apply it in the patient mouth. Then again, after application, you have to do the follow-up in the patient. So when you do the follow-up, this will complete the whole cycle. So this evidence-based process starts with the patient and ends with the patient. So I'll summarize. There is a no-do gap in our dental practice, and the evidence-based practice tries to fill this lacuna in our practice. But remember, evidence-based practice, patient preference is a very important aspect. So patients should always be educated towards the new treatment modality. But you should again give respect to the patient, because patient's preference is also important in evidence-based practice. Now, we have seen that evidence-based practice is not a rocket science, but it is definitely a science, and it should follow some set sequence. Okay. Should start with the framing of the correct questions, then searching of biomedical literature for the highest level of evidence. Then you have to critically evaluate that evidence and then apply in the patient's oral cavity. So with this, I'll conclude my presentation. Thank you for your patience and time. And sorry, I've exceeded my time limit. Thank you.
It's okay, sir. It's okay, sir. Thank you, sir, for wonderful presentations. Now, as a token of appreciation, I would like to present sir with the certificate.
Thank you, Dr. Rupna.
Thank you,
Thank
sir.
you.
Welcome, sir. Now, next, I would like to invite Dr. Satyen Jhasas, reader in the Department of Oral Medicine and Radiology, to guide us on the topic plagiarisms. Over to you, sir.
Thank you, Rupna ma'am. Am I audible?
Yes, sir.